Good evening to all. I am Dr. Ajaiy. Today we will have a discussion on a very short topic and a very important topic, the fractures of temporal bone. The fractures of temporal bone has been a very important question for your pre-final exam. It's been a very important trend setting exam point of view for your NEET exam. Okay, and there have been lot of image based MCQ every year in this topic. Okay, so fractures of temporal bone. Okay. So, what are the fractures of temporal bone? How are we classifying the temporal bone fractures? We are classifying the temporal bone fractures into two types, or it should be a mixed type, so three types. Okay, either it could be a longitudinal fractures, or it could be a transverse fractures, okay, or it could be a combination of both, that is a mixed fractures. Okay. So, what is the most common temporal bone fracture? The most common temporal bone fracture is the longitudinal fracture. So, longitudinal fracture is the most common temporal bone fractures. It accounts for around 80% of the temporal bone fractures. Okay. The transverse fractures accounts for 20%. The most common, a repeated MCQ, what is the most common temporal bone fracture? It is the longitudinal fractures. Okay. So, what happens in a longitudinal fracture? What happens in a transverse fracture? Actually, when I am drawing a picture like this, okay, so assume this is your skull, this is your skull, okay, assume this as a mastoid cavity here, okay, this is the petrous apex, this is the mastoid cavity. We know that there will be a foramen magnum here, right, and there will be here there will be a foramen, there will be two openings, right, one will be a foramen spinosum, the one will be a foramen rotundum, okay. Here there will be some foramens here. So, what are the two types of fracture? One is a longitudinal fracture and other is a transverse fracture. So, what is longitudinal fracture? Longitudinal fracture is a parietal blow. It is a parietal blow. That is say in a road traffic accident, following a road traffic accident, the patient has fallen like this, or it is a hit from the side. It is a parietal blow. So, if there is a parietal blow, as I said, there is a parietal blow. Okay. So, what happens in a longitudinal fracture? The fracture line now it's a parietal blow. So, the fracture line starts along the temporal bone, okay, along the temporal bone and runs parallel to the middle ear. Okay, it runs along the temporal bone. Okay, it runs parallel to the inner ear. It never cuts the inner ear. Okay, it runs up to the level of this foramen. Okay, so it runs up to the level of the foramen rotundum. Okay, so this is the longitudinal fracture. So it runs parallel to the inner ear. Never damage the inner ear. It runs parallel to the inner ear. So, but it causes injuries in the external artery canal. It can damage the tympanic membrane. It can damage the tegmen over there, but not the inner ear. Okay. So, what will be the problem in a longitudinal fracture? In a longitudinal fracture, here the fracture line runs like this. Okay. So, the problem is now there is an injury to the external artery canal, there occurs injury to the external artery canal. Okay. There occurs injury to the tympanic membrane, there can be even a perforation in the tympanic membrane. What this occurs? So, if there is an injury to these structures, the patient will have bleeding from the ear. Okay, the patient is going to have a ear bleeding, right? But apart from that, so also there can be damage to the tegmen and the ossicles also. Injury to tegmen and ossicles can also occur. Injury to tegmen, injury to ossicles can also occur. That can lead to a problem of conductive pattern of hearing loss. Right. So, there can be bleeding from the ear, the patient will have a conductive pattern of hearing loss. When you see the tympanic membrane, there could be even a perforation in the tympanic membrane, a traumatic perforation in the tympanic membrane. Okay. And there could be damage to the ossicles, the ossicular chain can be damaged. Okay. But it runs parallel to the inner ear, it never bisects the inner ear, it runs parallel to the inner ear. So, chances of inner ear injury, will there be chances of inner ear injury? Chances of inner ear injury is very less. Okay. So, what happens with the inner ear injury? If there is an inner ear injury, the patient is going to get an episode of vertigo. If there is an inner ear, we know that inner ear has a function of both hearing and balance, right. So, if there is an inner ear injury, then the patient's balance mechanism will be damaged and there will be sensor neural hearing loss. Will there be here now? Will there be in a longitudinal fracture, will there be sensor neural hearing loss? Obviously no, since the inner ear is not involved, the fracture line runs parallel to the inner ear, okay, inner ear is not involved and the balance mechanism also is normal, only a minimal vertigo can be there, that is because of the damage, that is because of the concussion, because of the fracture there can be a minimal vertigo, not a severe vertigo. Okay. So, note this point, it never bisects the inner ear, there will be problem with the external ear and the middle ear, but not the inner ear. Okay. And one more thing, the chances of facial palsy, this is very, very important, the chances of facial nerve palsy are very minimal, just only around 20%. Okay, it is very, very less, the chance of facial palsy are very less, since even if it involves, it involves only the which segment, it involves only the tympanic segment, it can involve only the tympanic segment, not the mastoid segment and all. Okay, the tympanic segment can be involved, but usually it could be chances of delayed facial palsy. Delayed facial palsy is, I will just explain it again also, delayed facial palsy is immediately, say there is not a bisection, the inner ear is not cut, okay, say if the inner ear is like this, 1 minute I will draw a picture, okay, the inner ear will be lying like this, okay. So, inner ear is not cut, okay, the inner ear is been, it runs parallel to the inner ear, so the facial nerve is not cut, okay, only there will be a edema, delayed facial palsy is, there will be a facial palsy after some 2 or 3 days. Okay, that is because of the edema, that is because of the fracture line there could be edema collecting over it. So, because of the edema surrounding the facial nerve, surrounding the inner ear area, surrounding the facial nerve area can turn into a delayed facial palsy. Okay, the chances of injury are very, very less if in case it could involve the tympanic segment rather than the other segments. Okay, so chances of delayed facial palsy is common, not a immediate facial palsy. This is regarding the longitudinal fracture. So, the most common fracture is longitudinal fracture. Longitudinal fractures have chances of facial palsy very less compared to transverse fracture, only 20% involvement, and the patient will have a conductive pattern of hearing loss, not a sensory neural pattern. I will discuss it again. So, coming on to the second type of fracture, the transverse fractures. The transverse fractures are very dangerous. Okay, so how it says is, say I am drawing a picture again, say this is a foramen magnum, okay, say the inner ear is here, as I drawn the petrous part of the temporal bone, say this is the petrous part of the temporal bone, and I am drawing the inner ear here, say the inner ear is like this, okay. So now in a transverse fracture it will be a occipital blow, that is a road traffic accident in which the patient has fallen like this, or it is a blow from back by some stick or something. So, it is an occipital blow. So, what happens here is, if it is an occipital blow, the fracture line starts from the foramen magnum, okay, and it runs up and it bisects the inner ear, it damages the inner ear, runs up to the level of, here we will have a foramen spinosum here. In the previous picture I have shown you, it runs up to the level of foramen spinosum. So, here what is happening here? The inner ear is damaged, there is a damage to the inner ear, right. So, the fracture line runs perpendicular to the inner ear, note the difference, there it runs parallel to the inner ear, here it runs perpendicular to the inner ear. Okay, but it is not damaging the external ear, the external ear is not damaged, it is almost a normal one. Okay, so now what will be the clinical features? Will there be problem with the external atrial canal? External atrial canal may be normal, the tympanic membrane may be normal, it never cuts the tympanic membrane, it goes and bisects the inner ear. Okay, but one problem, when you see the tympanic membrane, we can see some feeling of hemosinus. Hemosinus is, sorry, the hemotympanum. We can see some feeling of the hemotympanum. Hemotympanum is because the inner ear is damaged, there could be collection of blood within the within the middle ear cavity, that could appear like a bluish eardrum. Okay, it will appear like a bluish eardrum, but the tympanic membrane will be intact. No, have it in mind, the tympanic membrane, there will be no perforation, nothing will be there. The tympanic membrane will be normal, except that there can be chances of hemotympanum happening. But that is again, hemotympanum is okay, that is not a issue for the patient. But what is the main complaint here? What is the main complaint here? There I said the inner ear is normal. Here the inner ear has been bisected. So what is the main problem? The patient's inner ear is damaged. So what is the problem? The patient is going to have a severe balance disorder. The vertigo will be very severe, such that the patient can't even get up from the bed. The vertigo will be very severe. So inner ear is getting damaged. Okay, and what will be the type of hearing loss? The patient cochlea is also damaged. So the patient is now going to present with a sensory neural pattern of hearing loss. Okay, so sensory neural pattern of hearing loss, severe vertigo, and in this case the external ear is normal, the tympanic membrane is normal. So will there be any bleeding from the ear? Bleeding from the ear will be absent. There won't be any bleeding from the ear, but there will be hemotympanum. Since the tympanic cavity is intact, there won't be any blood or a fluid crossing beyond the tympanic cavity. So there will be hemotympanum inside. There won't be any bleeding from the ear. Okay, but one main thing is it bisects the inner ear. The inner ear has been bisected. It's been cut. Okay, so what it does? It damages the facial nerve. Okay, damages the facial nerve. So what happens? There will be a immediate damage to the facial nerve. So the patient, when he is presenting in OPD, when he is presenting in the emergency department, he will present with the immediate facial paralysis, immediate facial palsy. Rather than a delayed facial palsy, here he will present with the immediate facial palsy. That could be because of, say, this is the facial nerve, this is the facial nerve. 1 minute. Okay, say this is the facial nerve. It could be because of any bone chips which has been broken and it's just sticking over the facial nerve area, or it could be either a bisection of the facial nerve also. The facial nerve has been cut into two because of the fracture. Okay, the patient will have an immediate facial palsy, and the chances of facial palsy is around 50% chances of facial palsy. Okay, very important MCQ. The most common temporal bone fracture presenting with the facial palsy, it is transverse fracture. The most common temporal bone fracture is longitudinal fracture. Never forget this, never forget this. Okay, the most common temporal bone fracture presenting with the facial palsy is transverse fracture. Okay, transverse fracture. In a transverse fracture, as I said, it runs perpendicular to the inner ear. Okay, so this is regarding the difference between the two types of fractures, the transverse fractures and the longitudinal fracture. Okay, so I am just repeating the differences again. Longitudinal fractures, transverse fractures. Why I am repeating is this is very important one, both for your entrance exams and both for your clinicals, the pre-finals. Okay, so longitudinal fractures, as I said, the fracture line runs parallel to the inner ear. So again, as I said, it starts from it runs parallel to the inner ear, it never bisects the inner ear. But here the transverse fracture, it starts from the foramen magnum, extends up to the level of foramen spinosum, and it bisects or runs perpendicular to the inner ear. Perpendicular to inner ear. So what will be the chief presenting complaint here in the longitudinal fracture? The chief presenting complaint will be, there will be bleeding from the ear. Bleeding from ear. Okay, the tympanic membrane may be ruptured. Okay, but here there will be no. Okay, and the next main complaint, the patient hearing, it will be a conductive hearing loss here, it will be a sensory neural hearing loss here. Okay, and the vertigo, very mild vertigo will be there, that is because of the injury. Here there will be a severe vertigo, so that the patient cannot even rise from the bed. Okay, and the main difference regarding facial paralysis, here there will be most of delayed facial paralysis. Here there will be a immediate facial paralysis. The patient will present with a facial palsy rather than a delayed one. Okay, so then the next main complaint, CSF otorrhea, that is a CSF leaking leaking outside through the ear. CSF photoria can be seen in both, okay, but here it is seen in longitudinal fracture, since in transverse fracture the tympanic membrane is intact, so it doesn't come beyond the tympanic membrane area, it gets stagnated inside the middle ear, okay. So CSF photoria is seen in longitudinal fracture, okay, it is not seen here since the tympanic membrane is intact. Here we can see only hemotympanic cavity. Okay, so these are the clinical features regarding the difference between the two types of fractures. One will be a longitudinal fracture and other will be a transverse fracture. In any types of temporal bone fractures, we need to have in mind one important sign that is called as Bartle's sign. So Bartle's sign indicates if there is a fracture of the temporal bone, there occurs a ecchymosis over the mastoid region. That indicates a condition of Bartle's sign. So this is the Bartle's sign. Here we could see ecchymosis over the mastoid region. Ecchymosis over the mastoid region. Okay, this indicates a fracture involving the temporal bone. Okay, so this is regarding the types of temporal bone fracture. Okay, explained or very important, since in a NEET scenario what they will ask is, they will give a question like a patient presented in an emergency OPD, he presented with a road traffic accident, he presented with a fractured temporal bone. Okay, fractured temporal bone, and on examination he had a facial palsy, he had a severe vertigo, okay, and a sensorineural hearing loss. What could be the type of fracture? It is a transverse fracture. Okay, or in a scenario he will say that a patient presented with road traffic accident, he presented in OPD with the ear bleeding, there is an active bleeding from the ear. Okay, and on examination the tympanic membrane, it seems to be blood stained and there could be a rupture of the tympanic membrane. Okay, but the patient hearing, he had a conductive hearing loss rather than a sensorineural hearing loss. Okay, and the facial nerve was clinically intact. So what could be the type of fracture, temporal bone fracture? It could be a longitudinal fracture. So this is how they will ask in the NEET pattern exams. Okay, very important one. Any doubts? In case of any doubts, you can directly WhatsApp me in my number 9945279962. Okay, you can just WhatsApp me in my number. And for the pre-finals, you can access all my videos by joining my ENT app for coaching, that is Dr.Ajaiy ENT. You can just go to Google Play Store, type Dr.Ajaiy ENT, make sure the spelling is correct. Okay, I will provide you a link, source of the link at the down also. So this is an Android app which is dedicated exclusively for the pre-finals, where it will cover all the topics from A to Z of ENT, from the theory to the practical section up to your next classes. So it has been targeted, there is a master class series, so it will be very useful for you. It will contain both the free videos and the premium videos. You just check on it, it will be very helpful for you. And for NEET PGs, it contains some image based series also, it will be very useful for you. And for instant discussion in my Telegram page, you can join my Telegram page, Dr. Ajaiy Exploring ENT. This is my Telegram page and the Facebook page, you can join in it. Okay, thank you.